Hello, 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 everybody. Hi. I know it's been a while. Well, I guess it was, about this time last month I made a video. Um, this has been a difficult time, so I didn't want to make videos when I wasn't feeling well. I didn't want to put frustration and all that. I didn't want to make videos at that time because that's hard. I don't want to put more of that out into the world, if you understand that. So I got back from Portland, which was a lovely trip, seeing everybody that I've worked for, in service for others and being present and connecting with friends and family. I have great family in the Portland area and all along the Pacific Northwest. Most of my dad's family lives there. So got home after doing a midnight flight. They didn't even give you drinks. I mean, I know I was sleepy, but I took the blanket. So what am I going to do with it? I have no idea. Maybe leave it in the trunk in case there's disasters, right? And I was so glad my husband, my youngest, picked me up, and it was just lovely. So I overdid it, and that's my problem, balancing the surfboard of ALS. I overdid it, and the spasticity was terrible. I was there, and I think my first and live, I was in so much pain. I mean, when you're that tight, the muscles all over you are tight, and everything's pulling. When that relaxes, those muscles just are painful. And, I get the spasticity that grabs my hands, the stuff that make me look like Nafiatsu, the first vampire. Yeah, a lot of the horror movies, it seems, back in the day, were based on the things that made them scary were neurological symptoms in patients. Even the Joker with the hemifacial, looks. So that next Friday, I was going to my ALS clinic, and I was happy as a clam. I really was. Saw the people that I've been going to clinic with before I went in. It was a lovely couple that doesn't live too far from me. Mentioned that he was looking into clinical trials since he was not eligible anymore. And, me working on getting 3 more teeth pulled out because my clinical trial made my mouth really dry, and that doesn't do well for your teeth. It has some hesitance on it. I had been told that I'd be potential for the C9 or 72, similar to the Saudi medication that Biogen was putting up. They thought that would potentially be something for C9. And when I went in to see my doctor, which is Dr. Appel, I was told that had been actually, that clinical trial stopped because of the company pulled it back. So who knows what happened. I would much rather not take something that would damage me even more. And he told me that I was no longer eligible. According to him, I had ALS 3.2 months, which was beyond what they would do because people's neurological symptoms are generally, their system is damaged by the progression of the disease. I was incorrect when I did the live saying my ALSFR score was 37. The last one when I was in, and I was not told it, when I was in clinic was 28. And the next one, when he did it, I was 32. So with my spasticity, my ALSFR score will change, but that kind of hit me. And then my previous neurologist that I have suffered with the spasticity and the lack of pain control. While I was in the clinical trial, I was seeing a pain management doctor. And because of the changes and the things with that, and if you get off score and if you can't be in 2 places at one time and you switch things, you lose your ability to see a pain management doctor because you must show up, you must make your appointments, you must pee in that cup. So yeah, I have a little bit of angst about that. But I had been put on gabapentin since I was hospitalized last June, and Valium. It's the benzodiazepine or benzos that do that kind of take off, similar to like when you have a seizure. Sometimes they'll give you a certain benzodiazepine to stop it. It works that same way for me and my spasticity. I had guessed it, and it does work. And that's one of the parts of the drugs they do to treat ALS. So I'm on a very large dose of gabapentin orally, and Dr. Pell told me that he would increase my baclofen, but would not treat my gabapentin. To just go have my primary doctor take care of that. They like to do that, and no more Valium, because he was concerned that I'd become addicted. And I'm like, I just started crying. It's like, I'm not an addict. And that's been the one thing that's kept me from being in terrible pain. I have suffered with this disease with pain. So they look up and you see, look, oh, ALS is not painful. Later in the disease, and if you have severe spasticity, yes, it is painful. Pain is something that's not really treated with ALS patients, and somewhere, if you look at the clinical studies, and it's a little bit of a different word search, but it's just really not well managed or treated. Now, you don't want to give somebody narcotics if they have a weak diaphragm. I mean, build up CO2, you can rush them to death. So people should have adequate pain management. Now, in this country, in the United States, there is a major addiction problem, between manufacturers that have been sued to cartels bringing in all sorts of horrible, highly addictive drugs, and people are dying every day from it. I live in a particular state where they're very strict on things. Chronic pain patients fall into the part that are getting hurt by the restrictions. And it's just, and benzodiazepine, I mean, it's not something that's taking the pain away, but if it relaxes the clench, it helps me with pain. So I had been referred to one doctor, neurologist, for the hemifacial cramps, and ordered for Botox, which I have gotten the Botox. It's just, it's not pretty Botox. It's not the ones that, lines my forehead. They're still there. No, it's ones that were put here, here, and right here. It was a lower dose, 100 units, so hopefully that works. And when I'm on day 3, I should start seeing results in day 5. So hopefully that keeps it calm. I've been diagnosed with trigeminal neuralgia, which they say it's not ALS related. Well, if you look at it, it can be a preclinical diagnosis. I can look at anything from my eyes to the trigeminal neuralgia to that, saying, I may be a different picture among the umbrella of ALS, especially since I am a genetic patient. 10 to 12% of all ALS patients are, out of the 6,000 are diagnosed every year, 10 to 12% of them are genetic. My form is 60% of that. And every case of ALS is a little bit different. So finding that my ALS FSR score was different, and that it has gotten so low, and the potential of taking the gabapentin and the Valium away from me got me, like I was kicked in my teeth. And it's like, I was crying. I was crying. I said, oh, well, you're lucky. Well, lucky to be dying and suffering in a slow way and not heard when I cried out that I'm hurting. So I got back out waiting to check out, and then I see, the ones that were looking forward to, the clinical studies that for the non-eligible. There's a lot of people that have hope in the clinical studies. I was told that once the one that I did very well on, the Koya, once it gets, FDA approved, and I could be on it, but it's like, okay, so think about how long that takes. I'll be dead before it happens. So I was a little bit angry. I was feeling that. I had a follow-up with my primary doctor and got a palliative. I was told in the ALS clinic I wasn't eligible. Well, you don't need the palliative yet. Yes, I do. I have a serious illness, It's meant for the suffering. It's meant to go along. I have multiple serious illnesses. Somehow I'm still here. So my primary doctor said that he could handle the drugs, but he did give me the palliative thing. I went to see a palliative doctor, and she told me, yeah, went over the advanced directive stuff, which, any family member of mine that I've put into making decisions knows that I don't want to be intubated. I'll do the trilogy, I'll do that, but I do not want to be intubated. If I am dying, being trached or being tubed, and then it's always ends up being trached, even the G tubes, I don't want any, that's my boundary. I don't want anything put in. I'd rather have a more natural death. If I stop breathing, then that's my time. She told me that she was used to taking care of cancer patients. She did not have specialty in ALS. I made an appointment next year to talk to my family. Sent me a pain doctor, so I went to see the pain doctor. And the pain doctor will write for the gabapentin, will write for the Valium, but I must pee in a cup and no medical marijuana. It's like, I'm not a drug addict. I mean, I don't even drink. Do you have to prove when you're in pain that you're not an addict? I am going to be 50 this year, and I have never had an addiction other than Diet Coke and cigarettes. I quit the cigarettes. So nicotine and Diet Coke, those have been my addictive things. I'm not giving up Diet Coke. Well, caffeine even. So I have just been hurting. I have had my blanket pulled out for me. And, being not eligible made me feel like I was being expired. So I had a lot of acceptance to do. I find that, through this whole disease process, I've been in counseling for a long time. It's like being a healthcare provider before I retired, you have to take care of your own stuff so you don't put that stuff out to other people. You have to take care of your stuff so you can actually be there for them. I had done so much that I can go and talk and do my advocacy as a survivor of gun violence and speak out to help other people. You be the voice of those that aren't here anymore, and support others and be present for others that are speaking and provide that community. Even when I do the meditation stuff, I'm, as somebody that has lost people to addiction and disordered thinking, I'm there providing space and an ear for them. So, at the same time, this whole thing where I'm feeling this suffering, I'm feeling this pain, I mean, literal pain. When I was in Portland, there's one point that I felt like I was going to pass out from pain. The wild suffering I can have if I just try to live life like a normal person. I had and have had, each of you that have prayed for me, people that, send good vibes to me, family members that do things. I got contacted Lou Gehrig's Day, the day, when I went and I was like, that's the last time I do that. They put an ALS patient on the very last row. Someone had connected me and told me about this group called Compassionate Care ALS. And I've seen a lot of groups. I've lended my voice, my picture for, multiple organizations. You saw that when it was, ALS awareness, I did things for the Gleason Foundation, which they've helped me, the ALS Association, I am ALS, reaching out for that. So, but I've been to groups, none of them really fit. It's just a little bit different. It's like I've been asked to be a peer for I am ALS. I'm considering it. So when I heard another one, I'm like, well, they have compassion. And my practice and what I do is on compassion. I find that that has really healed me. You know, started with loving kindness in my 20s, and I find that that takes a lot off of, that takes my suffering and allows me to be connect for other people and give to others, which finds is healing to me, if that makes sense. And then I got contacted, and it is amazing. It's when you meet somebody, and I have never met someone that's similar to me, but that's kind of the situation. And this beautiful, compassionate, true group. I'm just beyond. They sent me a carbon wheelchair. That was one of my biggest worries because I have a power chair, which I still need a new row seat. But what happens when my legs don't work? I'd be trapped in the house. And actually, this week when I got the Botox, it was my daughter's 12th birthday, my youngest. And my husband and I were in grocery store because my husband, on top of her gifts, wanted to make sure she had a cooler full of Yahoo and Dr. Peppers in the glass bottles. He's such a sweetheart. And a little snack, so she got birthday cake, cupcakes. But we were there, and my legs, I was very spastic when I got up and blew up balloons. That's one of the things I like to celebrate birthdays. I like to make sure that they feel like you are so special. You are such a gift. You know, celebrate your personal New Year. So I did that, but I was walking funny, and I was in Kroger's, and I felt like my legs were going to give out. It was the spasticity was in my lower back, my hips, my buttocks, and the top of my legs. I've been having weird sensation in my legs. So it can be some of the angst of losing mobility, and that's part of the disease where you lose this little part, and you have to say, well, I'm going to be okay. I'm not going to hold on to the outcome. I'm just going to be okay. I'm just going to, letting go of stuff, but, you can't let go of emotions. They're still there. You can't let go of parts of your life. Those are still there. You just have to find acceptance and integrate them. So I was thankful that I had the carbon wheelchair, and that's what I was able to use to get the Botox appointment. So they started with 100, and if you can see, the right side of my face is a little bit higher than the left side. So I have the spasticity on that side. So hopefully, because my right side is where I think the trigeminal nerves get irritated when I have the spasms. So hopefully this works. Hopefully that pain doesn't come out. So, I've had all of this, this suffering. Went through one of the IMALS, or not IMALS, the compassionate care groups, and that was extremely healing. It's just amazing. It's just truly amazing. True compassion, true walking the path with somebody, and, just things that are just amazing. I'm just beyond amazed. I just feel very blessed. And it's like this humility. I've been someone that's had a hard time asking. I'll give you everything. It's just, is that a part of your ego where you just don't want to ask? And it's hard when you ask. For my healthcare, I've been asking. No one knows what to do with an ALS patient. Those that have specialties, world-renowned specialties, are like, well, that's not ALS. Send you to this person, that person, this person, that person. And having to advocate for myself, which I'm okay. I think everyone's the captain of their own ship, but it's hard. When you're hurting and you feel like you haven't been heard, and realizing that some of that might be, finding out where there's inside of me where that's from, what can I do to, figure out better ways. So, definitely keep on the counseling. And I've been blessed. Gratitude. I have good friends. I have good people. I have so much support. I can angst about this, but I can't keep my focus on that. I have to really see around, have humility, and see around and be so thankful and so grateful. I've had supplies that I couldn't afford sent to me to borrow. I've had, the talk about getting a toilet lift and that kind of thing that's going to be amazing for when I'm a little further progressed. And you never know, that can happen anytime. I got to have a beautiful wedding renewal. I had family that came down, that actually did that. I have so much love around me. I've had so many blessings. So it's just getting my mind around that. Oh, so when I was in Portland, I'm still going on about the pad thai. Not when I was in nursing school, in Seattle area. The pad thai, I worked in a daycare because it was the way I got $10 daycare for my oldest, and they had this kind of pinkish noodles, and I didn't notice. I thought it was pad thai, so I tried every way, every spice, every that, and then found out from that little restaurant that was delicious pad thai. It's a little bit of ketchup and fish sauce, so I tried it. I had well, it's not the perfect pad thai. It was one of those, um, dried ones that you can put a little water in the microwave. Yeah, not tasteful, not the real thing. But it had all the flavors, so I add a little ketchup. Yep, that's the secret. 30-year question answered. I mean, finding different groups when you have a major disease, and I'm always been a bit of an outsider. Um, I'm who I am. I'm what I am. I've always been who I am. I've grown, but I'm still who I am. And not feeling at home, and then finding one that just really fits. And that's just amazing. I mean, that alone um, is amazing. That alone, I should have such gratitude for, and humility and thankfulness. I'm amazed. So there's that. I mean, I wasn't doing videos because, why put out on suffering? I mean, there's enough suffering going on in this world. There's enough ucky. I mean, oh my God, you look at the news, look at it. No need to put more of that out. But yes, my form of ALS hurts. My symptoms have been facial cramps that hit my trigeminal nerves. My hand's getting spastic. It's almost like my hand goes back. It's strange. It's like this hand, if you notice this carpal tunnel, it's like my hand, you can see it go straight through because I'm starting to have atrophy in the muscles. So my legs are going out. I have extremely spastic muscles in my buttocks, hips, lower back, and internal leg, and the insides of my thighs. It's like nothing goes exactly, and who knows, every nervous system is a little bit different, but nothing goes that. My toes have been straight. So you know how you usually have like curves in your toes that kind of like that? My toes have been straight with the spasticity. So it's been really difficult. I have, when you're suffering and like I can't do the Aleve or the Motrin, my heart condition makes me fill up with water. There's salts, so I end up getting wheezy if I get short of breath, and I gain 10 pounds from the water. So Tylenol, and now we'll see what this is. The doctor wants to inject, the pain doctor, lidocaine, another drug, and dexamethasone. So I'll try it. I'm kind of afraid of it because it's, in my neck area, and it's like my next week. I found that out when I went and had the MRI, and at one point holding my head went back, and I hurt the back